Hello, my name is Dr. Nicole Quintero, and I'm here today to talk about anxiety, symptoms in children, and to provide some strategies to best support your child at home. I am a little bit of background about me. I am a licensed clinical psychologist and a board certified behavior analyst. I am currently the psychologist for the diagnostic program at Cornerstone's Therapeutic Services, which is transitioning into key autism services. I also am a mother of two. So I wanted to host this brief webinar because I've seen an increase in families expressing concern about anxiety in their children, and particularly within this past year. Anxiety in children can look like many different things. So my goal is to hopefully provide you with at least one new strategy you hadn't thought of, or even be able to provide you some information so you can look at your children's behavior differently. So stress and anxiety are often used interchangeably, but they are two different things. However, they both appear similar behaviorally, and they also respond to similar coping strategies. So stress can be healthy. It helps build frustration tolerance, resilience, and it is both good and bad. So those, anticipatory butterflies you get in your stomach the night before a big event or going someplace new and traveling. Conversely, it also can be bad, such as the stressors of paying your bills, adulting, parenting, etc. But everyone experiences it. It can be both short-term or long-term. Anxiety, however, is persistent, excessive worrying that does not go away. And it starts to interfere with your functioning. So that could be disrupting the family. It could be interfering with your work, interfering with your academics. So again, it's persistent and excessive. So what does anxiety look like in children? It can look like many different things. Withdrawal, anger, crying spells, clinginess, obsessive thoughts or repetitive questioning, trying to control, rigidity, inflexibility at home, temper tantrums, outbursts, including aggression, regression. So this could be a child's going back to playing with toys they played earlier in childhood or regressing to baby talk, maybe as a form of comfort. Restlessness, hyperactivity, physical complaints. So this is headaches, diarrhea, complaints of tummy aches, sleep disruptions, difficulties falling asleep or staying asleep, irritability, crankiness. These are all symptoms of anxiety in children. So I briefly want to discuss a couple different strategies. The first set being proactive. So these are strategies that you do at home within the environment to best support your child's mental health. So most kids thrive on structure and routine. There are some families that are really flexible, fly by the seat of their pants. They're in, 4 different sports across 2 different kids. So every day is different. But most kids really benefit from knowing their day, their expectations, structure, and routine. Now, with school being back in session, inherently there is more structure during their day. But with the holidays and winter breaks approaching, there is going to be a more lack of structure as well as good and bad stressors. So not all, but some kids may benefit from a visual schedule or to-do list for the day. It could be something as simple as a Post-it note saying in the morning, it's free time and play, afternoon, Target run, and laundry. Or it could be more detailed depending on the needs of your child as well as what your family needs are. So sleep hygiene are behaviors that support healthy sleep habits. Not everybody benefits from this, but individuals who are experiencing anxiety, this is one of the first areas you want to address. So again, not all kids need to keep a consistent bedtime. Some kids can stay up later on the weekends and then transition back to their normal sleep schedule Sunday night, but not all kids can. So exercise promotes healthy sleep. However, you don't want to do it near bedtime or have wrestling matches, engage in tickle fights before bedtime, because that's just going to ramp the kids up. Avoiding caffeine, so chocolate in the afternoons or evenings, although it might not impact their ability to fall asleep, caffeine can lead to shallow sleep and frequent awakenings. Also, some kids who have anxiety like to have talks before bedtime, and this is like their worry time. I think that having these talks are very important to support your child, to validate their thoughts and feelings. However, I would recommend moving worry time to a different time of day, because after you say goodnight, the child is likely continuing to have those thoughts and ruminating on them, and it can impact their ability to fall asleep. So exercise and movement breaks. This does not need to be long. Research has shown that with movement breaks as short as 30 seconds can help improve focus and energy levels. So this, by all means, is not a comprehensive list, but a couple of things I wanted to point out is I'm sure many of you have been exposed to this due to quarantine and remote learning, but Cosmic Kids Yoga and Brain Breaks, both are on YouTube, are wonderful movement breaks, vary in length and types and scenes. So again, you can adjust it to the child's interests. Another one I like is heavy work followed by relaxing work. So this could be doing jumping jacks and then transitioning to an activity, a leisure activity the child likes that calms them, such as doing a puzzle. There's also different types of walks and crawls. So that's using gross motor skills to expend energy. So you can have them do a bear walk across the house or race them doing a tiger crawl. Excuse me. You could also do obstacle courses. This does not need to be complicated. It could be something as simple as running around the couch 2 times, finding 2 doors and touching them, and then hopping like a frog across the kitchen. I think sometimes we get stuck on the thought of a more complicated obstacle course and tend to shy away from that strategy, but it's a wonderful thing that is simple to do and children really love doing it. I also provided a great website that has tons of ideas at the bottom of this slide. So calming strategies, this again is not a exhaustive list. Some of these you do not need to practice, but when teaching a child coping skills that are new to them, it's really, really important to have them practice when they're calm. This way, when you catch them in that yellow zone, when they need to implement these calming strategies, they will have practiced it with you and you would have reinforced and rewarded their behaviors as they're learning these new skills. Coping strategies and calming strategies, I equate that to like kind of throwing spaghetti at a wall and seeing what sticks. What works for one kid is not going to work for another kid. What works for one kid for a week might not work the next week. So I often tell parents to create like a coping skills checklist. You can have the child throw some ideas on there too, if they're old enough or insightful enough. But you just basically create a list and you try things out and you check them off or cross them out if they do or do not work. But again, it's going to be continually important to reassess, what the child is invested in. So for example, sometimes a good coping strategy for me is to go on a walk or go on a workout. Other times it's to decompress and watch Bravo TV. So again, just like adults, we have different, we have different moods, and what pleases us one day isn't going to please us the next or calm us down the next. Same with children. One I'd like to explain, which I think is a great idea, and you can simplify it based on the child's age and vocabulary or comprehension, is called the 5, 4, 3, 2, 1 grounding technique. So you start this by modeling taking a big belly breath with the child. So then you say 5, you ask the child to look around for 5 things that they can see and to verbalize that to you. So I see a TV, I see a candle. Then for 4, it's feel. So you have the child pay attention to their body and think of 4 things that they can feel. Like, I feel my back against the couch cushion. I feel the socks on my toes. 3 is listen. So you want to have the child listen for 3 sounds. It could be the sound of traffic outside, the sound of TV in a different room, etc. 2 is smell. So say 2 things that you can smell. If the child's allowed to, they can go to like the kitchen if they'd like to, sniff food. If they're not able to, just have them tell you 2 things they like to smell. And the last one is taste. So you have your child say 1 thing they can taste. It could be toothpaste on their breath, on their mouth from brushing their teeth, or if they can't think of anything, then they say their 1 favorite thing to taste would be. So reactive strategies are things that you use in the moment. So kids who are, experiencing anxiety or even behavioral challenges, they go from being calm to in the yellow zone, right? And then to very elevated. So we want to catch them when they're in the yellow zone and these precursory behaviors. So it might be a change in your child's posture, a change in their facial expressions, a change in their voice. And you can kind of see them starting to ramp up a little bit. It's really important to acknowledge their feelings. Let them worry is a phrase that we use. By saying, don't worry about it, it's not a big deal, you're essentially dismissing your child's feelings. So acknowledge and label, like I can tell you're getting, upset, I can tell you're feeling overwhelmed. Let's try some of the skills that we practice. Let's do 5, 4, 3, 2, 1. As a parent, it's really important to stay calm yourself and model these strategies. I know this is not easy at times, especially if a child is very irritable or having an outburst. Staying calm, cool, and collected during those times is very, very, very hard. But if calming strategies aren't working necessarily, you could always try just being fun and distracting. So for example, my son identified he likes to be taken to Tickle Town when he's getting upset. So for him, it's like essentially us maybe, putting him on the couch and tickling him, or, pretending to tackle him and tickle him, and just getting him to laugh to get his mind shifted from those thoughts and those feelings. And then when he's calmed down, we will discuss how he was feeling in that moment before we went to Tickle Town. Lastly, parenting is hard and humbling. So give yourself some grace, and you are doing a wonderful job. However, if you feel as a parent, you are getting overwhelmed with how to manage your child's emotions and it's impacting your parenting, or it's just impacting your own mental health, definitely reach out to a mental health provider for support. Lastly, I wanted to provide just some great resources that are free. So here's a list of websites and apps. Some work on iPhone, some work on Android. But again, these are websites I like, and I think they're great, and they're across age groups. So please take a look at this, write them down. Feel free to reach out, call me with questions or concerns. And again, my whole goal was to provide you just even with 1 new strategy you might not have thought about. And again, if you have any questions or concerns, feel free to reach out to me directly. All right, have a great day.